Hi, my name is Taylor Borchard. I'm a nurse practitioner student. How are you?
I'm okay.
Can you tell me your name and date of birth?
Hiroshi Shikoyama, and my birthday is 3/17/1959.
Thanks for coming in. How are you feeling today? What brings you in?
I'm coming in because I fell when missing a step, and I thought I pulled something, and so I waited a couple days, and now it's getting worse.
Can you explain what exactly you felt right when shortly thereafter the fall?
I felt like I pulled something.
Pulled something? Okay. And then what are you feeling right now?
Well, initially it was in my back, and then now it's going down my butt all the way down.
Okay.
I have pain and I have some tingling too.
Is it just on your left side?
Yes.
Do you have any obvious lesions or bruises?
No.
Okay. Did you lose consciousness?
No.
No. Have you had a history of falls?
No falls, but I have a history of back injury.
Okay. Can you tell me more about the back injuries?
When I was 50, I was in a car accident, and they said something happened with my lower back, so I have had pain all these years in my lower back. And then when I was 28, I got injured in a martial arts contest.
Okay.
But this is different.
Yeah. Are you, is it affecting your ability to do any of your activities of daily living?
I can't do anything around the house anymore because it's painful.
Is it affecting your ability to sleep?
Yes.
Oh, it is?
Yes.
Well, I'm sorry to hear that. Have you had any changes with your bowel or bladder?
No.
So basically you're having these changes with sensation that seems to be radiating down your left side to your interior thigh.
My hip, down my thigh.
Okay. All right. So I just want to go over a little bit of your past medical history. Can you tell me exactly, do you have any heart disease in your family? Well, specifically, let's just start with you. Can you go through your past medical history with me?
I have chronic lower back pain from the car accident. I have had high cholesterol for 7 years. I have a problem with my prostate. And then I also have had osteoarthritis for 5 years.
Okay. No hypertension, heart failure?
No.
That you know of?
Mm-mm.
Okay. Your family history, are your parents living?
My father passed away from a heart attack. My mother passed away naturally. And then I have a history on my dad's side of heart disease with a stroke and cirrhosis of the liver and also heart attack.
Thank you. Next I'd like to go through your medications. Can you tell me what meds you're on at home?
I take simvastatin
Okay.
every day, and I take Flomax every day, and I take Celebrix when I need it.
Okay, thank you. Do you feel like the Flomax is working well for you with your prostate and your ability to urinate?
Yeah.
Yeah. Has this medication been something you've been taking a while?
Yes.
Okay.
For 2 years.
Great. Next, who do you live with at home?
I live with my wife and dog and 3 children.
Um, is everyone in your family healthy?
Yes, they're all healthy.
Your kids are healthy, excellent. What do you do for a living?
I'm a landscaper. I own my own business.
Wonderful. Do you smoke?
No.
Tobacco, any illicit drug use?
No.
Do you drink? Excellent. Next, I'm just going to ask you a series of questions to help elicit if any of your other systems are involved
Okay.
besides your musculoskeletal.
Okay.
Are you short of breath?
No.
Are you coughing at all?
No.
Do you have any chest pain or palpitations?
No.
Are you constipated? Any abdominal pain?
No.
Are you having any increased frequency or urgency?
No.
Does it burn when you pee?
No.
Okay. Great. Are you more tired?
No.
Do you have any headaches?
No.
Do you feel like you're more weak at all in any of your
No.
extremities?
Mm-mm.
No? Okay. One thing that I wanted to ask you earlier that I may not have is, can you rate your pain out of 10, 10 being the absolute worst?
It's a 7.
It's a 7. And then, have you taken any medications at home to help with the pain?
I took after the first day I took ibuprofen twice a day.
Okay.
Oh, since the 4th day I took ibuprofen.
Thank you. So the next part is I'm going to examine you. I'm going to listen to your heart and lungs, and then I'm going to do your neurovascular exam, including a musculoskeletal exam.
Okay.
So when you feel the stethoscope, can I just have you take a deep breath? Excellent. I'm just going to listen to your heart. You can breathe normal. Great. I'm just going to have you hang here for 1 second, okay? Are you comfortable sitting here?
Yes.
Okay, I'll be right back. I'm so sorry for the delay. Okay, so this first thing is I'm just gonna examine you. You have appropriate strong posture. You're not leaning towards one side or the other. Can you stand up for me? You close your eyes and stick your arms out. Okay. And open your eyes now.
Mm-hmm.
Your balance is intact. You're not swaying towards one side or the other. Do you have any dizziness when you change positions?
No.
Okay. Excellent. You can take a seat. So next is going to do just a simple exam to look at your strength. So I'm going to have you pull on my hands and push on them. Okay, go out with yours and in. Okay, lift up your knees. Kick out and back. Okay, push against my hand. Push up, down, up. Right. And have you stand up. I'm going to be gentle because I know your back's hurting. So right now I'm looking at your anatomical positions. I'm looking, there's no obvious deformities to your back. Can you bend forward? Okay. Back, and right now I'm assessing for any scoliosis, kyphosis, lordosis. Next, I'm going to lightly palpate on your spine. Let me know if you feel any pain.
Ow.
Okay. Thank you. Next, I'm just going to go right alongside of your spine.
Ow.
Thank you. Seems to be around the same area here. Thanks. Can I have you flex at the hip? Yep. And then extend. Are you able to hyperextend at all? Okay. Thank you. How about some lateral flexion? Any pain there?
Yes, pain on this side.
Okay. And then can you try to do some rotation
Swivel.
of your spine?
That hurts.
Okay, so you're limited mobility there. All right, I'm gonna have you take a seat again. So next I'm gonna assess your sensation. This is called the sharp and dull test. It's a pretty simplified version, but it's an easy way for me to see if you have any sensation changes going down to your feet.
Okay.
This is the sharp.
Okay.
It's just a wooden stick, and then this is a soft Q-tip.
Okay.
Okay. So I'm gonna have you close your eyes and tell me if you feel if it's sharp
Or dull.
or dull.
Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull. Sharp.
Okay. Okay. Now we're going to go down to your lower extremities.
Okay. Sharp.
Sure.
Sharp. 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 Dull. Sharp.
Good.
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay. Great. How's that?
Okay.
Okay. Okay. So next I'm going to assess some of your reflexes.
Okay.
Okay, I just want you to relax your arm, okay? Okay. relax your arm.
Mhm.
Thank you. Nice. Almost done. And this one, it's a little difficult because you're so low to the ground.
Mhm.
So, I'm gonna have you lay down here. This last part is I'm going to assess, what I'm thinking is happening here is, I think you have some irritation to, your nerves that's potentially pinched,
Mhm.
by, something in your spine. This is not uncommon, but one of the best ways to find out is, to kind of assess. I'm gonna do your unaffected side first.
Okay.
So let me tell me if you have any pain.
Okay. There.
There? Okay. And to your left side.
Okay. Be careful. There.
So I'm gonna drop down
Okay.
5 degrees.
There.
So this is can be related to sciatica as well,
Okay.
or a lumbar neurological nerve involvement. So the treatment plan is going to be similar. I'm going to have you sit up. So what I want you to do is I'm going to print off some exercises, some stretching exercises that's going to help improve some of your range of motion, just trying to keep everything loose as you're in this healing phase. I want you to take Motrin
Mhm.
every 8 hours.
Mhm.
I'd like you to ice 3 times a day if you can,
Mhm.
especially during these pivotal times, so at least during the first 2 weeks.
Mhm.
And then I'm gonna schedule some physical therapy. They're just going to come 2 times a week for the first month,
Mhm.
and then I'm gonna have you come back in 1 month and see how you're feeling.
Okay.
Is this something that you're comfortable with?
Yes.
If you develop any changes of bowel or bladder, if you start feeling like you're having increased fatigue, uncoordinated movements, loss of balance, another fall, I want you to let me know, but I also am going to encourage you to go to the emergency room, because this may be a lot more severe and I want it to be addressed right away. So please don't hesitate to reach out if you have any questions or concerns, okay?
Okay.
All right. Thank you.
I'm good with this.
Thank you.
I think you got it.
All right. Thank you.
Thank you.
I appreciate you coming in.
Okay.